Well, if you go to the hospital, there's no guarantee you're going to be treated within, say, 8 hours.
Hi Neil, it's only me.
Since February 2022, Neil has been receiving care from his home, which he describes as a godsend. Now he avoids long waits and says it puts less pressure on his family to take him to the hospital for routine checks and treatment.
A nurse coming to change my dressing on my foot every Tuesday, which is fantastic. You know, instead of having to trail up to Royal Blackburn, or maybe even go as far as Burnley. So that's great to have a nurse coming to change my bandage in my own home.
As a patient of the Royal Blackburn Hospital, clinical home care was set up for him to treat his severe eczema.
It does make a massive difference, particularly to people like Neil, because it's very difficult for him to mobilise outside of his home. It does impact on his family as well. But, you know, so for people to have to get to the hospital each time they needed treatment is quite a big strain on them, really, together with the condition that they're already facing.
Across the country, junior doctors will be taking strike action for the 7th time, and it will be the second joint walkout for junior doctors and consultants.
As consultants' pay has been falling, more and more consultants are choosing to leave the NHS, leave the UK, and go and work in other countries where they are paid fairly and their terms and their conditions of working are better because they haven't got such a staffing crisis. In the UK, we're left with an NHS that has a workforce crisis because of this government's policies. That means that we never have enough doctors, and those that are working here are trying to cover the work for the doctors that aren't there.
As for Neil, he says the 2-hour appointments he gets at his home are invaluable at a time when NHS services and staff say they are feeling the pressure. Theo Chikomba, GBNews, Blackburn.